Aloha, I'm Dr. Jill Hogarth Green, and I have the privilege of being the CEO at Queen's Health System. And I get to talk about something that I'm very passionate about, which is vaccinations for preventing the COVID disease. This month, we've all been reflecting on this very difficult one-year journey. And this disease has been devastating. But because we've been working together, and every one of us has taken on our kuleana to wear our masks, keep our physical distance, assure that we are doing the protective practices that keep us safe, we are making it through it. One of the ways that we can bring this to a new normal and help us resolve this disease is getting vaccinated. And this week was a major milestone. This week, we moved to level 1C from the CDC guidelines. And what that means is kapuna that are age 65 and older can have access to the vaccines. The Department of Health has also outlined that individuals that are 16 and over that have high-risk chronic conditions can also have access to the vaccines. And those conditions are specific. If you are on dialysis, if you have lung disease and you're on home oxygen, if you have heart disease and you are on home oxygen, or if you are a person that has cancer and or an autoimmune disease and you're getting an infusion in infusion centers, you are also eligible. There are also some transplant patients. And with that, all you need to do is call and we can schedule you and assure that you're matching up with those criteria, and then you can get access to the vaccine. In addition, the Department of Health, who's doing a very masterful job of looking at individuals who are high risk because of the work they do, is updating the list of the essential workers that can be able to access. And you can access that information at the Department of Health because they update that on a regular basis. Here at Queen's, there is no more important work than to get you vaccinated. And from the first time we started back in late December until now, we just yesterday hit our 100,000th dose of vaccine that we've given. And we want to give more. One of our goals internally is that we will have enough vaccine on island that we can deliver to you in your arms 5,000 shots a day of the vaccine. If we can do that, in addition to all the other wonderful health systems, Hawaii Pacific Health, our community health centers, Kaiser, all of our groups are working together in collaboration with Department of Health. If all of us could do our part and we can get enough vaccines on islands, we have the ability to be able to move forward sometime in the middle or end of the summer. So we're committed to doing that. Now at Queen's, we are honored to be able to have one of the mass vaccination sites at Blaisdell, and that will continue, and we'll continue to increase the number of slots based on the amount of vaccine that comes in. In addition, we are starting another mass vaccination site at our West Oahu campus starting next week. We felt that it was important that there be many points of access and that it's a long way to travel from the west side of the island. So having a mass vaccination site there will enable more people to have access. And in addition, we've bought some vans and we have teams that are going to be going to different communities as they're invited to be able to provide a pop-up service to get you vaccinated with the teams that we have already on island that have been doing that work all along. Those are just a couple of the ways that we want to continue. And I see those from our other collaborators in our health systems, whether they are doing mobile kinds of vaccinations, whether they're adding additional sites, we are all working together to make sure that you have access to the vaccinations. If we get vaccinated, it will move us to a new normal. Right now, though, even though over 20% of us on island have had at least one shot, it's really important for us to not let our guard down. We're in spring break. We're increasing our ability to bring in travelers. We're increasing the number of people that are able to do the activities as we've gone to tier 3 that we have had to limit over the last many months. But with that comes a responsibility. It's very important to be wearing our masks, keeping our physical distance, and continuing to wash our hands, even if we're vaccinated. At this point in time, it's actually one of our most opportune times to go forward, and we're still very vulnerable that we can have another surge. So please, for the safety of yourself, your ohana, and the people you care about, please get vaccinated when you're able to be vaccinated, and please wear your masks. Aloha, stay well.